Hi there, welcome back to All Things Homecare. I'm your host, Dana Arnone, and we are live here from the Broadway Mall in Hicksville. We are going to be here for a couple hours filming, so if anybody wants to come down and if you have some questions from our panel of experts, or if you just want to come down and talk to us, or if you just want to come down and learn about home health care, come down. We're going to be here for a little bit longer. But right now, I am sitting with Laura Ploetzke, nurse practitioner, and Linda Polistin, who is director of social work at Bel Air Care Center and also social worker that works with us. One of the things that we always like to talk about is educating people about what's available to them in the community and what things that they probably don't realize is out there. So Laura Ploetzke, thank you for coming. She is a visiting nurse practitioner, and Linda actually does a lot of work with Laura in the community and with setting up people with home doctor services or home nurse practitioner services. And the name of the company is Home Nassau.
No, it's called Nassau.
I knew I was going to miss that.
Nassau Home Medical Visits.
Nassau Home Medical Visits. Okay, so tell people, it's funny because whenever I get a referral from a family or we're talking to families and I realize that they're homebound or there really is difficulty to get out, they don't realize that there are home doctors with their doctor bags or nurse practitioners that come to the house these days.
Exactly. We're a group of nurse practitioners that will come to the house and take care of all your medical needs. We have we're affiliated with x-ray departments and labs. Everything that can be done in your doctor's office pretty much can be done at home. And we follow patients on a regular basis for home visits.
Right. It's funny because when families will call up and they're starting service with us as an agency, one of the things I'll be like, well, who's your doctor? Oh, she hasn't seen a doctor in 8 months. We can't get out. Okay. Or I can't afford to get her in an ambulette because there's a cost attached to the ambulette.
Exactly.
So I always say, okay, well, if you like, I can give you some referrals for the visit to people to come visit them. And people are like, oh, they do that? I'm like, yes. Mm-hmm. So there's a definite lack of knowledge of people of what's out in the community and what best suits the needs of their family members.
Yes, and Medicare, we can bill Medicare, but the patient has to be homebound, meaning that either they need a walker to walk or they have difficulty getting out of the house. And even if mentally they can't get out of the house without somebody with them, they're eligible for home visits.
Yeah, okay, so it's kind of like working with, I guess it's a Medicare guideline.
Yes, that's okay. A Medicare guideline.
All right, so a lot of times people say, well, what is homebound, what's the term homebound mean?
Exactly.
So we used to say is that if it takes any type of exertion to leave the home, or if they can't leave the home unattended, then they're considered homebound.
Right.
So let's talk about a normal referral for you. So Linda, you refer to Laura's company, right? So why do you feel as a social worker, discharge planner, that a home doctor services or nurse practitioner services are better suited for families? And who would that family look like to you?
Well, at Bel Air, the goal is always to make sure the patient go home safely and stay home in the community to prevent rehospitalization.
Well, that's a big thing. Everybody's looking to limit rehospitalization.
Correct.
Yeah.
However, it's a little difficult as they get older. They go back home now to arrange transportation. You mentioned before, it's a cost to it. The weather, it's cold. So, and the family sometimes is not even available to take them there.
Let me say something. I'm sorry. You just said something I want to make sure that I say because I will forget because I probably need a visiting nurse practitioner soon. What people say all the time, and I'm sure you're going to say this, is that, Medicare pays for ambulette. They got me to my doctor's appointment from the rehab center. They don't realize that the criteria once they're home changes completely.
That's correct.
Thank you. Mm-hmm. All right, now you can go.
So anyway, it makes it easier it's like a good transition to know that there is a nurse practitioner that can come to the home and to follow you and assist you with all your needs, review your medication. Everybody loves it. And I have to say, Laura has been wonderful.
Yeah, and we refer to her a lot too.
Yes, and all I hear is always the pleasant thing, so I'm very happy to do that.
For me, not that I'm saying doctors aren't a great thing, but I'm a registered nurse, you're a nurse. Social worker, we have different minds.
Right.
So when I enter a home, I'm entering the home looking at the person. I can assess you from head to toe without even talking to you, and I'm sure Laura can too. So I think that sometimes people would like a nurse practitioner coming to the home. They'd probably get coddled a little bit more. They'd probably get spoken to a little bit nicer, maybe. I don't know. But I know that for me, people, when they start having that service in the home, they never want to go back to leaving in a freezing cold. There's snow outside, it's cold. They don't want to be outside in the cold.
Or you're sitting in a doctor's office for 3 hours.
Oh, that's true too. Yeah. And they get sick because everybody's sneezing on them.
Exactly.
So let's talk about, I should have the mic, sorry. So let's talk about real quick. So right now, flu season.
Okay, so we vaccinated over 300 patients in the community with flu vaccination.
That's
Yes.
amazing.
Yes, yes.
So flu, because and sometimes people can't get out. A simple thing of getting out to get their flu
Exactly.
shot is very hard for the families.
Right, or in any other, immunizations.
Right.
We do
And you do
provide.
all that.
Yes, as long as Medicare.
Is that a
covers
covered
them.
item?
Yes, as
Okay.
long as they're covered by Medicare.
Okay,
yes.
perfect. And then what about, so let's just talk about a normal homebound elderly person that you care for. They're going to be seeing you how often?
Well, at first I like to see the patients frequently because I like to get to know them. Like to get to know the families. I like to know what the family's values are and the wishes for the patients, and it takes a little while. So I could see someone every 2 weeks for a little while. And then once I get them stabilized, get all their bed ordered, their commodes, everything that they need to function independently in the home, then it's usually every 6 to 8 weeks, as long as they stabilized.
Right, so my interaction has been like if someone is sick, do they call you and you'll come?
Yes, they call us.
Okay.
We give phone advice, and we usually can get to the house within 24 hours.
Okay, so it's not that they can. It's another way of avoiding that hospitalization.
Exactly.
Because we want to keep them home, and sometimes people
Exactly.
will think that their hospital is their only answer when really they can be treated in the home and not have to go anywhere.
Exactly.
100%. Well, the goal is that to maintain them in the home safely,
Right.
and I'm a firm believer, and I'm sure Linda agrees with me that having case management services or home services is the way to keep them home. So you don't
Exactly.
have to go to the hospital because you have a fever, let's say. Maybe
Right.
sometimes you do. Maybe you do. But for the most part, it can be treated antibiotics. As I know that one of the things that we have that happens to us a lot is urinary tract infections. We can tell the signs of one of our patients when they're getting a urinary tract infection. Instead of going to the hospital, they can have you come in, start the
Right.
antibiotics, and treat them immediately.
Exactly.
Oh, yeah.
That's exactly what
Can I say if there is a need also while you're in the home to refer for physical therapy?
Your mic.
Oh,
If there is a need, right?
Right.
While the patient is home, let's say after 3 months later, patient is declined.
Right.
Would you be able to make a referral
Definitely.
to therapists to come to the home?
Definitely. I just want to, make this clear. We are very different than what the visiting nurse service does. So it's not uncommon that the visiting nurse service will be in the house and we will be overlooking their care as a physician would from an office. So we can refer to visiting nurse services when someone has a wound that needs to be changed. Sometimes they change catheters for us, or sometimes we do it ourselves. We're able to get you physical therapy from a visiting nurse service, and there's also Part D of Medicare that you can have additional physical therapy. So we're fluent in all those the rules and able to get you the most help at home.
Right, but you're writing the prescriptions. You're not doing the treatments for them.
No,
You're
we're
the ordering.
referring them.
You're the
We're
ordering
referring
nurse
them,
practitioners.
but we know where to refer and
Right,
get the job
yes.
done.
Well, because you're home based,
Right.
and you know who the home based people are.
Exactly.
I had a question. It just went out of my mind. I'm telling you, I'm going to need you soon, Laura. Wait, it was a very good question. Payer sources is Medicare.
Medicare, we take Medicare has to be your
we have
primary,
my
or
question
you
now.
could be in a Medicare Advantage program, but it has to be a PPO service.
Right. Okay. Now
You can't be in an HMO; they don't pay for home visits.
That's ridiculous. Well, that'll change soon too. Okay, here's my question, because I know this is going to come up, and I had this happen to some of my families. If they're going to utilize your service, can they utilize your services short term, or is it?
Definitely,
Okay.
definitely. The patient's home, you're scared, they're saying your mom has to go home. What am I going to do with her? We get the patient better. If the patient has the ability to get back to functioning where they were, then we say, go back to your primary doctor.
Okay.
If you can get there, go to your primary doctor.
But they can't have both of you.
They can't have both
Right.
of us.
Right.
So either we're the primary caregiver or the physician is. So
Because I know a lot of the families say, I don't want to give up my doctor. I've
Right.
had him for 30, 40 years, but they don't understand that could be on the short term or...
exactly, and you just go back once they're walking and they can get back to the doctor's office. We have no problems with them going
Yeah,
back.
that's what okay.
But they can also go to specialists while they're seeing us. Some patients see their cardiologist.
Yeah, but you're talking primary doctor. They're internist.
Not primary doctor.
No, I'm saying that they can't have you and the primary.
Exactly.
But they have the specialist.
Right,
Yeah, that makes
exactly.
sense.
Yes.
And then where's the territory? Now, you're Nassau based.
We're Nassau based. We go from Merrick down to Lindenhurst, and then we do Plainview and Syosset.
So if someone was to call you and they're out of your area of where you have staff that can go, could you give them some ideas of where else to go? Are there other
Yeah, we could
doctors?
refer them to doctors or other. North Shore has a visiting.
Yeah, but they take a long time to get in.
Yeah, it's a long wait for them.
Yeah, long wait. I'm sorry, I probably should have said that, but it's true. Because you said that you can get in within 72 hours.
Yes.
That's important
Yes.
because when people go home, they're not thinking, I need a doctor. Like for us, we need our order signed.
Right.
So I always say, do you have a doctor. Oh, no, I haven't seen my doctor in 2 years. Well, you got to get a doctor.
Right,
And you got to
right.
get someone to come in before we come in because we're going to want to talk to somebody.
Right, exactly.
And they're only if they're coming out of a rehab facility, they're only giving prescription meds for a short period of time.
For
kind of
it's
2
2
30
weeks
days?
to 30 days, yeah.
So it's kind of forcing them to see their doctor.
Yes, yeah.
Which is important because, they have to understand that the medication and all those other things is what's going to keep them home. One of the things that we are out there talking to people about is limiting and the rehospitalizations for the elderly.
Right.
So are you well versed on the penalties for the hospitals? Like, the hospitals want you to maintain
Right.
their people at home.
They do. They just recently closed a bundle program that they had, that the hospitals were not getting bonuses, but the rate would be increased if the patients didn't stay at the hospital for 90 days after the patient was discharged.
Why they?
It was a pilot program,
Oh.
and there's another one coming up. I'm not sure which it is.
Same concept, though?
I'm not so sure, but I don't
Yeah.
think. Yeah, I'm not so sure.
But the idea of the hospitals being financially penalized for a rehospitalization within a certain amount of time is still there.
Right. Oh, yes,
Yeah.
yes.
And
They'll
it's
definitely
90
look at
days?
that. 90 days.
Oh, I thought it was
Yeah.
30.
Yeah, I think
90.
it's 90.
Yeah. Well, I mean,
Yep.
and what is the rate of your families being rehospitalized within 90 days?
Right.
Is it high? Is it low? Is it what would
I
you
would say maybe 20%. Some people are just sick. It's family values too.
Mm-hmm.
Another thing that we specialize in is palliative care. When patients start recycling back to the hospital, the families kind of say they don't do anything when I'm there. What? And then we talk to people about palliative care. It's letting people die with dignity at home, and we are very good at that. That's what our mission station.
Do you work
is.
in conjunction with a hospice, or?
We definitely refer patients to hospice, but we stay on the case. We don't desert patients.
Yeah, that's good. I like that.
Yeah.
Because once again, like we were talking about the respite, she doesn't do hospice,
Right.
but the same concept. They want to, the families want their loved ones to be safe and secure.
Right.
And dying with dignity is
really
the
the way I
least we
wanna
could do.
die. Yes.
I really.
Right. So at the end of life, we the hospice isn't in, and we can't get them in for a few days. We do start medications to keep people comfortable.
Nice.
So they don't have to go back to the hospital.
That's good. Okay, so Laura, tell people just once again how they can get in touch with you. I mean, they can visit our website, and we'll have your information on the
Sure.
website. But just so that people out there, if they have an elderly person or a loved one that they can't get to the doctor, or they didn't even think this was an option for them,
Right, exactly.
how could we get that information?
You can get in touch with our practice by calling 516-586-3716. Again, 516-586-3716. And our email is nassauhomemedicalvisits@yahoo.com.
Perfect. Or you could visit us at reliancehssny.com. We'll have Laura's information on there. Or if you know Linda, I'm sure Linda can find her for you.
You'll find me.
Yes. So again, you can find Laura's information is at reliancehssny.com. I have to say, I'm surprised when people don't know that this is an option for them. So when they call me up and I tell them, they're always so surprised. So
Right.
it just shows you how much information people are looking for out there in the community. And you're doing a great asset. Yeah, I'm a
you.
firm believer in home care, and I'm a firm believer in everything being done for people in the home if
I
necessary.
agree. Yep, I agree. It's,
Perfect. Thank you so much.
Thank you very much.
Thank you,
for
thank
having
you,
me.
Linda.
Bye-bye. Thank you.
Hi there, it's me again, Dana Arnone from All Things Homecare. Just wanted to remind everybody to find us on Facebook, iTunes, or Google Play. Follow our podcast. Let me know what you think. If you have any suggestions of information that maybe you'd like to hear, or it's something that you can have some help with, or some guests that you might like to see on the podcast, or maybe you yourself want to be on our podcast, we'd love to have you. So give us a call here, 516-308-4840. Visit us on our website, reliancehssny.com. You can talk to me through the website. Please let us know what you're thinking.